All right, I'd like to take you through an anatomy lesson here, okay? So first of all, this is a normal knee, all right? This is looking at the front of the knee. This is the outside, or what we call the lateral side of the knee. This is the inside, or what we call the medial aspect of the knee. This is your patellar tendon, which connects to the patella, and this is the quadricep tendon, all right? During knee surgery, we have to move this out of the way. This over here is your lateral collateral ligament, or LCL. This over here is your medial collateral ligament, or MCL, all right? So once we move the kneecap out of the way, we can see the cruciate ligaments. And right here is your ACL, and the sister ligament in the back here, is your PCL, or posterior cruciate ligament. So anterior cruciate ligament in the front, anterior is front, posterior cruciate ligament in the back, PCL, all right? So then we bend the knee like this. This is the femur bone, okay? This is the femoral condyle on the lateral side, the lateral femoral condyle. This is the medial femoral condyle, and this light blue, that's supposed to represent healthy cartilage, all right? That's the surface that glides. That's what a healthy knee is supposed to have. And on the bottom side, the tibia bone here, we see the medial tibial plateau and the lateral tibial plateau, and that's healthy looking cartilage. This right here is medial meniscus. This over here is lateral meniscus. An arthritic knee always has tears in the meniscus, usually on both sides. If it's a varus knee, which means there's wear on the inside, there's usually tearing over here. And if there's wear on the outside on a valgus knee, there's tearing over here. So sometimes if the tear's not too bad, you can get arthroscopic surgery to kind of clean that out. But if the cartilage gets damaged, that surgery doesn't work and you end up needing a knee replacement. So let's look at an unhealthy knee, okay? So this is an arthritic knee. So the ligaments are all the same. Still have your quad tendon, your patellar tendon, your patella here, but now if you look, that blue, this black here is supposed to represent cartilage that's gone. So the blue cartilage has been worn away, and that's exposed bone. That's what we call bone on bone, all right? We still have our collateral ligaments, our medial collateral and our lateral collateral ligament. But when we open up the knee, we see this is a big cartilage defect. That's exposed bone. On the lateral side, there's cartilage defects, and there's cartilage defects in here. You would expect this knee to have tears in the meniscus. So this is a knee that needs a knee replacement, okay? So let's look at a knee replacement now, all right? So with knee replacement, we do not do anything with your ligaments, okay? Your ligaments and tendons, for the most part, stay. Now there's a couple that have to be removed, and I'm gonna go over that. So your quadricep tendon here and your patellar tendon here stay intact, all right? The kneecap itself gets moved out of the way again, all right? But what we do is resurface the kneecap. So you can see this little piece of plastic here. So we cut a little bit of the kneecap off, just enough so that we can then cement that little patellar button on there. And that prevents the patella arthritis. When there's arthritis under the patella, that keeps that from being painful. Your collateral ligaments, the medial collateral ligament and the lateral collateral ligament on the sides, those both stay intact. You can't cut those. That's what's required for knee stability. But your cruciate ligaments, your anterior cruciate ligament and your posterior cruciate ligament can get cut during surgery, okay? Those can get removed, and the implant is designed to account for that. So a knee replacement, when we say a replacement, what we're really doing is a resurfacing, okay? So there's four parts. We already discussed the patella part, but I'm gonna go part by part. Typically, the first thing we do is cut our femur, right? There's a bunch of cuts. There's a cut here, which we call the distal cut, which is the most distal, and then there's the anterior cut, the cut in the front, and there's a posterior cut and the cut in the back. Then we have what are called chamfer cuts, which are these oblique cuts here and here. And that's there so that it fits the anatomy of the knee. And we're gonna see, this is the Journey 2 total knee. It's actually designed to get a little bit better flexion. So instead of the cut in the back being straight across like every other knee on the market, this one's got a little upslope. And that upslope means when this goes on and you bend it back, that slope gives you a little bit better flexion. So the bone cuts are designed to fit the implant perfectly with just a little bit of cement on there. All right, so that's the femur. Let's look at the tibia. All right, the tibia is for the most part a flat cut. All right, and we'll look at this when we talk about ligament balancing, but traditional knee replacements, you put a rod down the tibia and you make a flat cut off of that. You're trying to make it basically at 90 degrees to the shaft of the tibia. And then the tibia has a keel on it, which is this right here. And so cement goes down into the hole that we make, and cement goes on the tibia, and then we cement it in. Now, in this one right here, this piece of plastic, this white, is not going to come off. But this white piece right here that come in different sizes. For this implant, it comes in 9, 10, 11, 12, 13, 15, 18, 21, 25, 20, you know. So it keeps going and going. For most knee replacements, we use anywhere between a 9 and a 12. Occasionally we use something bigger, but those are usually reserved more for revision type situations. So we tend to have, you know, a little bit thinner polys, and we can go up by 1 millimeter or down by 1 millimeter to really dial in a perfectly balanced knee for you. So the way this works is a knee doesn't just bend and straighten, but a normal knee will actually twist and slide like this, and it's supposed to, all right? But most knees are not designed like that. This Journey 2 total knee is. It's designed to act more like your native knee, and we're going to show that in some videos here.